So Jess, can you introduce yourself for the audience?
I can do it a second time since this is our second episode.
Nice.
My name is Jess Ellis. I'm a PT. I've been working in either professional sports or professional athletes for over a decade. Um, I've worked at Exos. I've worked in the NBA. I'm starting a continuing education company called Rehab Code, which is return to play and a little bit more sports rehab specific. So I've been busy with that.
So, being at Exos, being at Trailblazer, like, w- uh, which part of when you're at Exos, which part of being at Exos do you enjoy the most, and which part of being in the NBA do you enjoy the most?
Exos was always fun because there was just a mixture of athletes. You know, you could and general pop, so it was a good blend of many different cases. So it really allowed you to learn quite a bit because there wasn't as much redundancy, which requires you as either a PT or a strength coach is you learn to talk to your athletes to understand their sport because you may be working with a you know an NFL player, and then you're following up with a collegiate baseball pitcher. Very different sports, very different demands to their body. So it just, in a way, it requires you to be a little bit more humble because you're going to try to hear the athlete out and gain as much information from their perspective. So yeah, the mixture was great. The coaches, nutrition, all of them are amazing over there. So the teams are always fun when you're over at Exos. And I managed the five facilities, so I got to see the difference in staff and culture. Now Exos is kind of pulled back, and I only think they have three um, legacy facilities now. LA and San Diego are no more. But again, it was nice to see the subcultures within the culture of Exos. So that was pretty solid at Exos. And then in the NBA, everything's amplified. The pressure, the energy, the expectations, the limelight, all of that is changed because you're in a market that a lot of people are watching. So I enjoyed that as well. We were very successful, made the playoffs every year, and got to work with some amazing athletes. And it's much different because you're addressing different injuries because it's much more specific to basketball. So I was able to hone in on injury prevention and understanding where we could mitigate some risk. Um, and we had a smaller staff as well. So we had the smallest staff in the league, which then required all of us to kind of step up and have a lot of autonomy within our roles.
Nice, nice. So, um, last time we talked, we were discussing about the tests you would do for different environment, different sports. So today I kind of want to start with the spine. A few months ago, there's tons of discussion about spinal engine theory. So first off, I want to start with for athletes American football or basketball. There's jumping, landing, speed, that kind of stuff. So, how exactly do we keep our spine healthy?
Well, it is in any sport, you should be addressing core and lumbar strength. And when you look at the sport, you need to look at basically the demands of ground reaction forces and how they're emitted through the body. So you're going to look at the spine a little differently from an NFL player versus an NBA. And that's just not from a anthropomorphic profile because right, NBA is much longer, slender players, so they have different moment arms and levers than let's say the NFL player. But then secondly, the playing surface is also different. So in an NBA athlete, they are much more vertical based, though there is a lot of horizontal deceleration that happens within that sport as well. But there's just more vertical loading that happens, and with that longer spine, one thing I really look at for an NBA player is um, can they absorb load through their knee, and if they can't, things start to be problematic. And what happens is it travels up to the hip, and the relationship between hip and low back, they're so close in proximity, and there's so much interrelationship between these two junctions or complexes that if one goes south, the other one's going to go very quickly. So an example would be if you have low back pain, you may start to limit the way that you walk, which then will, or the hip flexor may hold you in a protective pattern, which then limits hip extension. So it started as low back pain and then resulted in restricted hip. And then now you're having a multi-joint issue, or it could be vice versa, where the hip is irritated and then it limits the amount of extension, which then allows the lumbar spine to extend more. And now you're dealing with maybe overloading of the low back. So between the two, it's almost like you have to address both. And then for the NFL player, there's just much more contact related, more overload dynamic load to where they're trying to pull somebody off or make a move. And, that's more commonly related to a strain. So a muscular or maybe a ligament sprain per se. So basketball, I think more overload or kind of osseous injuries like facet because of the vertical base, and then the specificity of football is maybe more muscular, but that's just a general thought. I can't hear you.
So there are like tons of video on the YouTube or like on Instagram. There's like NFL like running back, wide receiver, like squatting super heavy, like uh 600 pounds of like back squat. Do you think that's gonna cause some like stiffness or like some like micro damage in their spine that affects like the overall performance?
I'm not going to say a blanket statement of if it's good or bad. It is, what's the lifting age of the athlete? Can they comfortably go through a movement pattern with a heavy load? And why are you doing it? So what's the risk versus reward? You don't have to max out these guys or, really push it, especially within season where you could get at least a minimal dosage effect at a smaller weight. But in general, these guys are very adaptable athletes and they're super strong. So I would just base it on each individual and if they can demonstrate the capacity to load their spine. Now, can you modify range of motion to limit likely chances of an injury? Yes. If you do a partial range of motion squat, so you're not going past 90, then in theory, you may not have a pelvic rock where you can fall into some flexion and then, or a butt wink is what we call it. And that can happen, and that results in possibly some disc irritation or a facet problem. But again, you just got to be, smart with your training and have a reason why you're doing things. Now, the NBA, if you've ever worked with an NBA athlete, they don't really understand how to go into a deeper squat. A lot of times they have adaptive changes to their ankles because they've jumped so much that there's an osseous block to the front of the ankle, which means they limit dorsiflexion. So in that case, much of that depth is restricted distally, and you're not going to be able to go as far. So you may have to fall into some plantar flexion to the ankle to then allow them to go into deeper depths. But in general, these guys jump from their ankles and knees, and they don't really fall into much of a deep hip pattern, either hinge or squat. So if you're going to train it again, understand why you're doing it. One thing I found with NBA guys, um, they have such long spines. So if you do like a Zercher squat, I look at that squat as more of a core exercise than let's load up the system with weight. And in doing so, I think you can prevent some low back injuries. So a Zercher squat, lighter weight, but look at it more like a dynamic core exercise than like I want to really train hip extensors. If you're going to do that, do a barbell squat or a trap bar deadlift.
Nice. So, oftentimes we see like power lifters or like uh guys in the weight room, they squat really heavy, they deadlift really heavy, they probably have like a flat back. So is there like any exercise or like movement we can do to like uh at the same time help our athlete to have like a healthy spine, have the curve to like absorb the energy and at the same time help our athletes to like get stronger, produce higher force.
Sure. So when I look at athletes or if I train their spines, let's say they have low back or something that leads them to a rehab case, I break up low back training into three components: motor control, uh, general patterns, and then um, reactive. And reactive is much more either transferring energy through a med ball or absorbing force through some sort. So I think you blend between the three, and it changes the way you approach treatment as they go further down the rehab. Maybe do less motor control and you do more power based reactive exercises. But for us to just do general patterns like a loaded hinge is only going to get you so far. You still have to be able to absorb and release energy, and that's um, where you can kind of get more interesting exercises that they can again catch weight, throw weight, um, fall into different patterns and catch themselves. So that's I don't know when you talk about the flat back with, I'm assuming, are you talking with like a deadlift?
Yeah.
Yeah. A flat back, I mean, that neutral or is that flexion? What's your thoughts on that? Because if it's neutral, you're fine.
I think that's gonna uh depends on the person, but most of the time I saw I'm not gonna say everyone, but most of the athletes they do deadlift, there's probably a little bit flexion.
Yeah. Now, are we talking like an actual deadlift, or are we talking about a trap bar deadlift?
Actual deadlift.
Okay. So yeah, I don't overly try to cue them very much. I just see the 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 amount of range of motion that they have, which will likely be limited by their hamstring depth or their flexibility is the thing that will usually restrict it. And then if it's a partial deadlift based on mobility restrictions, you can train it through that. Now, if you want to gain more, you can do eccentrics with lighter weight to get some dynamic lengthening to the posterior chain. But I don't cue too much. I don't really overanalyze spine position. I just a lot of times with a deadlift, I just make sure that their cervical spine is in a neutral position because that will usually mirror the lumbar position as well.
Cool. So, um, after the spine, I want to discuss about the hip. So when um when athletes run, the hip's gonna be undulated. There's gonna be a little rotation in the hip. So let's say what if uh they already have like one side of the hip is like more tilted backward and the other side is more tilted front to the front. What and that's probably gonna affect like how how much they can lift their knee and how much they can push off from the ground. So what are your thoughts on this? Or and like how would you do some corrective exercise for the hip?
Well, if we're looking at structural nuances of asymmetry, the first question is asymmetry bad? And is it something that we need to try to, and I hate the word correct or correctives because I just think that that puts the athlete in a passive role, like they're broken or they're not a fully capable human. So when I look at that, I said, does it need to be changed? Secondly, is it a specific adaptation based on the sport? If it is, then I'm not changing it. If it is a problem from a muscle recruitment, then we can kind of figure out why that's an issue. So if there is an imbalance, how much of it is problematic versus just a natural adaptation? So that would be an area where I would want to train and maybe work on symmetry if possible. Um, I've never felt like anybody has had enough limited hip range of motion to really affect running. And if so, it probably would be hip extension, not hip flexion. So that's something that I would look at just because you want to make sure um, if somebody is heavy lordotic to their lumbar spine, they're more prone to a hamstring strain because the lack of posterior pelvic tilt. So now that hamstring's always on a lengthened position comparative to, let's say, in a neutral spine. So we could train all we want, but I don't know how much that carries over to the actual action that we're trying to change. So that's just one thing I want to like keep at least honest is like we can try our best with a lot of these things, but we don't really know if they actually change the pattern. There was
Nice.
an example was there was a study done for runners and they had knee pain and they went 6 weeks with um, isolated hip strengthening and they were very due diligent and they looked to see if anything changed. And after 6 weeks, the running, though their hips were stronger from a handheld dynamometer, their running pattern was the same. So even if you do make some isolated change from a quantitative stance, it doesn't mean it's going to change the pattern that you're trying to improve.
Yeah, or it's gonna make it worse.
True. Yeah.
Yeah. So, like last time we discussed, are you gonna do or are you gonna put some like tests for the spinal health in your test in the NBA or like in the football player?
Yeah, you should. Especially in the NBA. I mean, low back is a problem that can I call it they're sleeping dragons because they once they're activated, it's tough to settle down just because of the moment arm and the long levers that these players are in. If it's good, it's good. But if they do have back pain, it usually takes a little bit longer for them to recover. And that's similar to like a shoulder injury. And again, that's because the length of their arms. So it puts that complex also in a disadvantage. So yes, you should screen the low back and hip. Um, I would say just getting some general range of motion assessment of the hip and spine. Um, I think what I found anecdotally is if there was a notable difference in hip internal rotation, if you were looking at both, if there was asymmetry with limited internal rotation, the side that was limited was going to be possibly an area for that side of the low back to be aggravated. And that's because likely when they go into a squat or in a defensive position, they go into flexion, which then includes internal rotation. If they have limited internal, then it might result to go up the chain into the low back. So that's something that I noticed. So range of motion is important. I like to look at when I have them go into like a plank position. Everyone really likes to see how long they can hold it. Sometimes I like to do repeated cyclical positions where they have to fall into neutral each time. So they come up, get into the position that I want, then set back down. I want you to do that 6 times. And if they can't find that position, we have a motor moron. We have some neuromuscular issues that they don't know where they live in space. So at that point, then I may have them do smaller durational holds, but more reps for them to find that position that I want them in.
Nice. Cool.
And then one other plank position that I have them go into, it's a kind of like with yoga, it's like a cobra position where you drop your hips into extension. But as they fall into extension, I'm watching their back to where their spine is from neutral into an extended lordotic position. And there's that transition. And I find that point where they fall into it. I pull them slightly into some flexion, and then I have them hold that position, and I take a time baseline of that, because that right there is their, I call it their pivot point.
Cool. So besides like plank or besides like using Cobra, do you like functional movement screen or like they start with like lying on the back, then doing some plank or like high knee and then standing. So besides like plank or like Cobra, do you use other exercise for like core and overall low back pain?
Exercises or screens?
Exercises, sorry.
Yeah. Um, yeah, I to be honest with you, I try to simplify my lumbar training to um, they either need to produce force, they either needed to produce force fast, or they need to show endurance or work capacity. So if I want them to just, if I want the paraspinals to be at a high engagement, I'm going to just have them deadlift and dose it accordingly. You can do like a mid thigh isometric pull to see where they're at maximally, and then you can kind of go from there. One nuance that I've done is for NBA guys, I don't like to do a mid thigh isometric pull because they have such long spines and they can hurt themselves by doing that. So instead, I have them in a deeper squat position and I just have them do a squat pull from the ground. And then I get my objective number there. And then we can kind of dose some loading from that number. Um, so deadlift is a primary focus. Now, trap bar deadlift versus deadlift, I prefer the deadlift position, but people interchangeably use that. I'm not saying that I don't do both. It's just if I'm going to train, let's say the quads and glutes, I'll probably train more trap bar deadlift. If I want to specifically hit lumbar, then it's maybe more of a general deadlift. Um, and then rotatory, so being able to own it with, you can do some anti-rotation work, you can do some general rotation through, you can do some loaded stuff, and then you transition into some power specific movements with med balls or even cables. um, and then like I had mentioned before, how do they absorb through their knee? So if they can't absorb through their knee with deceleration exercises, then they're likely going to have a hip pathology at some point,
Cool.
because if you can't load through the quad, it's just going to be a spike of ground reaction forces that goes up to the hip, and you're dealing with something that's maybe more labral or cartilage issues in the future.
Cool. So for those like those NBA guys, they have like longer spine, longer torso.
Yeah.
It's gonna be harder for harder for coaches, harder for you guys to like teach or like train the traditional like deadlift position. So is there like something you need to do before like teaching these?
Yeah, I mean, a lot of times you see see these NBA guys that cannot hinge. They don't understand the pattern. So you may need to do some assisted work with a band where you're pulling them into some hinging. So getting them to understand that movement. And then a lot of these guys learn with speed, like they're just fluid movers. So if you can get them to do a kettlebell swing properly, they can kind of own that pattern. And that might be the first thing that you get them to do, even before you do like a straight isolated deadlift where you would assume that's easier to learn because it's not as movement derived, but these guys love that fluidity of movement. So even like a kettlebell swing might be a preliminary exercise that you have these guys do with a hinge.
So like you mentioned that most of the guys or like most of the NBA guys, they you're gonna look at like how their knee gonna flex or how their knee gonna absorb. So a lot of times, like you mentioned, you're gonna like look at the knee, how 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 they land and how they move their knee. So that's gonna affect the force from the ground to the knee to the hip. So since that, why don't we just train like you mentioned trap bar deadlift instead of like traditional deadlift? We can probably just to how to like properly load it through like knee and hip so we don't have to like teach them how to like or teach them like the traditional deadlift.
Yeah. So I would say my philosophy when I'm training, let's say an NBA athlete, if I want to load their system, and that's let's say 80% one rep max, I'm going to do a trap bar deadlift. It's easier on their system, less chance of an injury. The center of mass to the weight is much easier on the spine. And they usually understand how to do that. So if I'm clearly just wanting to load the whole system, I'm going to do the trap bar deadlift. Yes, the standardized or traditional deadlift is much more posterior chain. So if I'm going to again address hamstring strength or lumbar strength, I may go less weight on a traditional deadlift, but it's because I'm changing my focus. And I also know that this man has a long spine, so I may either modify the range of motion or modify the weight, but still getting enough adequate dosage to do the things that I want, which is hopefully adapt the spine and adapt the hamstrings. So in general, if I want to stress the whole system, hex bar or trap bar deadlift, if I want to work on deceleration, you can do some variants with the trap bar. You can do like some drops, some eccentric drops, but important, you can do that in other fashions as well. Deceleration lunges, some landing techniques, um, or just get them on an isokinetic dynamometer or a knee extension machine and literally just load that eccentric load, which is probably the best way to isolate the quad.
Nice. I love your approach. So wanna jump to the spine or the knee question. I wanna continue the conversation we did about from last time, like you mentioned, creating your own testing. So I know we've discussed this before, but still like for like NFL player, there's gonna be a lot of like XL, DCL change of direction. So based on these, like what kind of tests would you do for a physical therapist to see their athlete's situation right now?
So if you're dealing with anybody that does multi-directional, I think you got to look at each plane of movement. So how do they look with their lateral lunge? How do they look with landing, not just your standard, your standard box drops, or where you're maybe pivoting and having them to absorb and then go from there. So like a depth jump or a drop jump. Um, I think the other things that we look at, a 505 test, which is really heavily focused on deceleration. And then you can do some variants of that where it may not be a 180-degree cut. So NFL, you're going to see more 180-degree cuts than in basketball. Or not many times in a basketball game where they're going to have to do that outside of maybe a turnover where they have to rapidly change the other direction. So you can change the angles based on the sport. So basketball, it might be a 90-degree cut. It may be you know, a 75-degree cut where they're coming backwards because they're accelerating. Now they have to stop because their opponent is going forward. So now how does it look with their ability to get back? So yeah, that's cutting drills. You can look at just general footwork. You can do some ladder drills just to see the capacity. That does not relate to true actual sport, but it also is nice just to see their neurology and how it reacts. So those are some general things I look at.
Great. So besides like the cuts, do you like watch the film like in for individual athletes?
I do watch film. I think everybody as a professional, if they work with the elite of the elite, you got to be prepared. So I watch to see how they play because every player is different. Some are elastic, some are not. Some are aggressive in the way they play. Some are smart and they don't use as much energy. Um, some of them are older, younger. So there's a lot of variables to look at. So yes, I think you should watch the uh, the actual player, and then you talk to them. You really break it down. You interview them. You see where they really feel like they're limited, and not just words. It's good for them to actually demonstrate it. So that's why I really like to have conversation with athletes, either on the field or on the court, where we are talking and they're like, all right, you said you feel it limited here. Let's kind of go through that pattern. And it's much more of an organic, intuitive process. And secondly, then you get a lot of buy-in because the player sees that you're engaged and you want to know what they're feeling. Clearly, I'm never going to be an NBA player in NFL, but I do get some credibility and respect if I'm actually directing my focus to what they're feeling, because you can come off as very arrogant as a practitioner because you know biology, you know anatomy, you know all this stuff. We're a bunch of nerds, but we got to listen to the jocks because they're telling us good information. We just got to be humble enough to listen to them.
I like this. I like this. So, want to dive deeper into, I know we discussed like how you plan or how you're gonna design the test for like the NBA guys. So this time I want to dive a little bit deeper about like how would you design tests for overall like football players?
So football players, I've never worked in the actual professional setting of football. I've worked only in the off season with football. Um, so I think in general, the problem with the NFL is the numbers. The NBA, I only had 15 guys, so I can get really specific and really lock in on my system. There's a lot of NFL guys, which means one, there's a lot more to do, but also there's a lot more data. So I think in the long term, like a longitudinal aspect, I think you can get better results and you can specifically change your system because of the data that you've collected. But with the NFL, I'm probably going to go much more general view because the sheer numbers. So how do they squat? How do they hinge? What's their hip range of motion? What's their ankle range of motion, um, posturally with their low back versus their hips. Then I'd like to get isolated measures of quad and hamstring because of uh, more hamstring in the NFL, see how strong they are. Um, I'd also like to get peak force production to the calf, just because the chances of an Achilles or a calf injury as well. And that's kind of the snapshot. And then you can maybe do some standardized tests on the field where everyone has to do the same thing. Um, Technology is advancing. So there's things like Plantiga, which I'm an advisor on that team. And you can have them wear a device, an AI device, where it tells you the symmetry of the limbs. So if you were to put that in everyone's shoe and get at least 6 practice data points to then when they roll out into the season, you have 6 to 8 data points, you know the symmetry of that player. So if they come later through the season and you see there's a 5% change, you can feel more confident because you've had enough data to show that these are his tendencies. He's 5% more on the right. Now he's 10% more on the right. Clearly, there could be something going on with the left knee or the left ankle or whatever.
Good.
So I think the advancement of testing is mirroring the advancement of technology.
Cool. So, uh, since you brought up like technology, is there gonna be difference between like when you use like uh stuff like force plate for like NBA players, and the metrics you're gonna look at when you test the NBA players, and the metrics you're gonna look at when you see like the football players? Is the metrics gonna be different from a physiotherapist standpoint?
Yeah, I think so. Everything's different with um, the nuance of sport. So metrically, if you're looking at, are you talking about like workload data
Yeah.
specifically? Yeah.
No, like everything, all the metrics you're gonna see.
Yeah. I mean, yeah. If you're in the setting, you better you better change to that niche of an athlete. If you're not doing your job. It's not like you're going to be, if you're in NFL, you're not going to be seeing any NBA guys. So, it's nice maybe cross pollinate and maybe talk to some practitioners on that side and take some of that information and then absorb it into your system. But really and truly, it needs to be specific to the sport that you're working. So every metric would be different. Workload metrics would be different. There's, you know, mileage changes, the amount of deceleration versus acceleration. So for an NFL guy, let's say a skill player, I'm going to be, more engaged on the acceleration capacity of an athlete. In the NBA, these guys don't have to accelerate as much. And if so, it's only maybe 2 steps. Um, their sport is much more driven by stopping efficiently and verticality and landing. So those would be specific workload metrics I'd look differently. So NFL, I'd look more for physiological workload metrics, and then I'd probably hone a little bit more attention on um, mechanic, um, mechanical workload, which is more of a reflexive of the deceleration variables.
Nice.
But
So
that's just from workload. I mean, you can break it down to screening as well. I mean, it can get very deep.
cool. So there are more and more technology in like sports science and like helping athletes recovery. Overall, like um do you think that it helps nowadays, it helps coaches more, or it kind of like made coaches rely on these technology or rely on the data instead instead of like losing like the coach's eye, or like the movement we should be more focusing on?
Specifically to the NBA, I don't know about the NFL, but as we continue to grow the staffs in the league, you'd expect to get better results. But what you're seeing is there's more injuries in baseball and in the NBA. So the question is are we as smart as we think we are? The other thing is are we overemphasizing workload and maybe creating this babying of an athlete where we're softening them up and giving them too much information, and that's leading to more games missed. So I do think there's like clearly there's a transition right now in sports, and it was much different in the 90s for the NBA. You don't see as many guys hurt. So, but the gameplay is also much faster. So, with more velocity, there's more injuries, and that's same with the NFL. So, if I could understand those nuances, I'd be a very rich man. But instead, I don't, and I'm just trying to be honest and figure out what's the best way to make a few small changes to influence the team. So yeah, that's my thoughts on that.
Cool, cool. So, uh, since there are like you mentioned, there's more and more injuries in the NBA or like in the baseball. Um, what do you think are the next big thing that coaches or therapists should be focusing on?
I think the first thing a therapist should say is, have you ever played any other sports when you were a young child, a young kid? And if they said no, I actually just played baseball in my life, or no, I just hooped. Um, they're clearly very specific to one sport, which means their body has been specific to one form of load, which means we got to be more aware of the things that could go wrong. So that'd be one element is where is their capacity of athleticism and how early was it started. So sports specificity is what we'd be speaking of. Um, and then what was the additional to that question? Sorry.
Um, like what's the next big thing for like physical therapists or like performance coaches?
I think we all just need to get along. Um, and there's been some encroachment on turfs when really there should just be a continuum. It should not be this kind of delineation where one steps over to the next. That being said, there are physical therapists that are feeling more comfortable with strength and conditioning type of roles. And I think as a profession, we still need to honor the other side and make sure that we're not overstepping our boundaries, because you can't be good at everything. I don't care how smart you think you are. Um, I would advise any PT that wants to be in sports to find a high level strength coach and not to collaborate with that individual, actually seek him or her out as a mentor, as in you are here and I am here and I need to learn from you. And I don't think a lot of physios or PTs do that. But I think you get a lot farther along in your career and just understanding sport if you would do that. And then on the other end, strength coaches are becoming much more reconditioning, or hey, we're going to live in this in between world of return to play, which is fine. I think they have a role. Both of them do. But PTs have a great understanding, especially high level PTs and trainers. I'm going to throw ATCs in as well. They have a good understanding of pathology and loading and what are the things from a medical lens that you should do. And that's in essence why I created I'm going to do a pitch here, Rehab Code. And I'm teaching a course called Reconditioning, which is open up for strength coaches, trainers, and PTs, because I don't think any one practitioner owns that world. Instead, I think we need to communicate and learn and understand the nuances of each person. Now, in that course, it's much more from a medical lens, which is coming from my background. But I think strength coaches and individuals that are on the performance side would actually take a lot of benefit from that because it could enhance their role as well.
Nice. You have like a weekly email for discussing like from rehab, right?
Yeah.
I love
And
that.
not just rehab, performance. So it's called Weekly Decoding Newsletter.
Yeah.
Um, it's been well received. There's a lot of people that are on it. A lot of people click on it and read it, but it's on one topic every week, and it's a PT related article and then also a performance related article on the same topic. So you get a nice little breakdown of each lens, and that's my job. I've been in both worlds. I've worked in the highest of the high for the NBA and Exos, and I feel there's an issue with the lack of understanding that each practitioner has, and that's my goal, is to get that to be more seamless.
I, I gotta tell you, like, I love the email.
Hey, I got a fan.
Yeah. And and since you brought up like you think that PT should have like a mentor for like from a coach, PT should find a coach for a mentor. Do you have like your own mentor?
I mean, I've been blessed to work with high level strength coaches for the last close to 10 years. Um, and when I talk to them, I want to hear their thoughts. So yeah, I think each person needs to find a high level strength coach. Um, the low key one is the veteran track coach, where they're not even really a strength coach. They've just watched a lot of movement for years and years and years, and they may not even have a formal title or education. You can learn a shit ton of stuff from them as well.
Agree, totally agree with you. I hired a sprint coach myself to watch me sprinting, watch me do all types of like change of direction. And I personally learned a lot, and that kind of like helped me train my athlete. Totally agree
There you
with your
go.
view.
Yeah, I think we should all get on a camera and not post it on Instagram. I think we should all get on a camera and see you in your work environment. So, in case of a PT, if I have a client, I want to have a camera base. I mean, of course, the patient has to be okay with it, but I want to see how I communicate with them. I want to see my question sequencing. I want to see if I missed up on my exam because I got lazy. I mean, we all live with a lot of biases in life. And as long as you're aware of them, you can get better. If you're unaware of them, you're just going to be stuck in a rut. So, and then with a strength coach, it'd be good to see how good do you look with some of these movement demonstrations, or how was my energy, how was my presence amongst the staff? Was I was I able to take in the whole environment? Like sometimes you got to alter the way that you address an athlete just based on that immediate 10-second interaction. You got to be able to catch that and be like, oh, this guy's down a little bit today. Like maybe I don't go at him as hard. So it's a psychology game. We all got to try to win it over. So
Nice, nice, nice. That's kind of like all the question I have for today. So for those like coaches, for those like therapists want to learn more about like the rehab code or like the email you mentioned, where
yeah.
can they find it and where can they find you?
So it's easy. It's Instagram is rehab under dash code. Website's the rehabcode.com. And I'm pretty active on it. So if you want to message me, I can get back to you very quickly. Um, let's see. LinkedIn is also useful. So those are kind of my three. I don't do Twitter. So I've never done Twitter. So now I'm starting to fall into threads like everyone else right now. uh, until we find out who wins in the cage match between Zuck and Elon.
Nice, nice, nice.